Usually, when we think about problems in the cervical spine, we think about tingling, numbness, or nerve pains down in our arms, or heaviness in the shoulders, or maybe a headache going up in our head. However, we don't think much about dizziness. But it is possible that problems in the cervical spine give rise to dizziness. So these are known as cervicogenic or cervical dizziness. And this is what we're going to look at in this video. So, if you have dizziness and your doctor has told you that it is because of neck pain, or you suffer from headaches, and now dizziness is another component that's got added to it, then you probably want to watch this video and know more about cervical dizziness. All right. So before we move on, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids manage their spinal and back pain. When I say spinal, I mean spinal, that is back, neck, and joint pains. And I do so with simple exercises, easy lifestyle or changes in your daily routine. And I also incorporate natural, non toxic products that I use on an everyday basis. I give you some simple tips, tricks, and hacks to use in your daily life. Now, let's get back to the topic for today, that is, can problems in the cervical spine cause dizziness? Now, the cervical spine, if you look at the cervical spine, it is a very important role to play in our balance and coordination. And if you are looking specifically at the upper to mid cervical spine, that is from your hairline to the middle of your neck, if the this area is affected by, say, disc bulges, or stenosis, arthritis, degeneration, any of these issues are present in your upper to mid cervical spine, and because of this, there's a pinching in of the nerves in that area. It can lead to dizziness, and it can lead to even unsteadiness or incoordination or balance issues. And of course, it can lead to headaches as well. Now, this is not something that is always seen with dizziness, but you might have some neck issues with moving your neck in the full range. So basically, if I can look over my shoulder all the way on my left and my right, or I can nod my head or tilt it sideways, you might find that some or the other range is of the ranges of the neck are also restricted. So this may or may not be present along with your dizziness. Now, there are many other causes of dizziness, such as vertigo, that is problems in your inner ear. They could be related to your brain, or it could be something to do with the medication you're taking, or blood pressure, low hemoglobin, etc. However, if your doctor has ruled out all this or given you a diagnosis saying that your dizziness is because of your neck, this is what is happening. It is present in your upper to mid cervical spine. And if you want to manage this, there are three things that you need to do. First is to manage the dizziness itself. That is, what do you do when you feel dizzy to make you feel better? Second is to manage the problem in your neck. That is the basic cause. That is, as I mentioned, the disc bulges, arthritis, degeneration, or stenosis, or whatever's happening, the disease process that's happening in your neck, or even if it's simple strain and your muscles are in spasm due to any reason, and this is pinching or irritating the nerves in the area, which are in turn leading to dizziness. So you need to address this problem in the neck. Now, the third and mostly overlooked area that needs to be addressed with dizziness is your mid back or your thoracic spine. Now, the reason for this is usually people who are watching a screen or they're working at a laptop all day long tend to have a very slouched or rounded posture with the mid back. When you do this, in order to balance your head on your body, you need to stick it out forwards. The moment you stick your head forwards, that is this forward head posture, you will most probably aggravate or flare up your uh, issue that is present in the cervical spine, which will in turn lead to pinching of the nerves, which will lead to more dizziness. So you can have a flare up of dizziness indirectly related to your mid back position. So that is again the third thing that you need to manage. So Of course, this is beyond the scope of this video. I cannot address those three issues here, those three components of treatment here. However, if you are interested in knowing more about how to manage your cervical or cervicogenic dizziness or your neck pain, you can join my free community. I have done a couple of trainings there. Right now, we're doing a training on simple solutions to manage your cervicogenic headaches, which runs in parallel to your cervicogenic dizziness. I have also done a training there to manage your neck pain. So once you join the free community, you can access all these trainings. You will have lifelong access to them. If you're watching me on Instagram, the link to join my community is in my bio. If you're watching me on any other place apart from Instagram, I will leave a link in the description of this video so you can join my community from there. Also, if you are not sure about what is a forward head posture and what is this nerve pain or headaches that I'm talking about, you can have a look at my YouTube channel and you can look at the videos that I have done on these topics. There are quite a few of them. If you cannot find me on YouTube, just go to the search bar on YouTube and type my name, Swati Prakash, followed by forward head posture or cervical headaches, etc., and you'll be able to see those videos. Alrighty, if you have any questions for me, any comments on this video, do drop them below and I will address these for you. Alrighty, hope